Hey, on This Week in Pharmacy, one of my favorite subjects. I love talking shop with fellow marketers who are deep into specific places within our ecosystem in healthcare. And I don't know if you guys have ever heard of a company called Outcomes Rocket. I was so excited to meet the team at Outcomes Rocket and how things are changing. Marketing is not the same as when I entered the space of long-term care pharmacy in technology. And then, of course, had to um, teach myself marketing for pharmacists and pharmacy owners and how that's drastically different than marketing telecommunications, which is the industry that I came from. Saul, it is so good to finally have you on my show in This Week in Pharmacy. Welcome to the show.
Wow. Hey, listen, Todd, thank you so much. Such a pleasure to be here with you. We've had, a couple conversations prior to this, so it's really great to be here with you and with your amazing audience.
Started this out just saying the word marketing, and that's so obscure. It's so kind of like hidden of what it really means. You go so deep into the specific needs of a client within the healthcare space. Give our listeners background on why you guys have rocket shipped growth and how you've experienced that over the years.
Todd, hey, thanks so much, man. Really, really appreciate the opportunity to share about Outcomes Rocket. And look, I've been in healthcare for the last 18 years. I was sort of born, I would say born, my career was born in medical devices. So I wore many different hats and sales and marketing, and I climbed up the ladder all the way up to VP at Medtronic. So I was an executive there. And I remember just kind of looking around, man, and just thinking to myself, is this what I really want to do for the rest of my life? By the definition of success, I was there, but I wasn't feeling it on the inside. And I remember the day that I made the call. My palm was sweating, my heart was beating so fast. And I was about to give my 2 weeks after a very long, successful career and gonna take the leap into entrepreneurship.
That's so scary.
Well, it was, man. Like you made the jump, right? When did you make the jump, or like, what's your story on that?
Yeah, I had to pharmacy podcast started 2009. I didn't go full time until 2019, and I had to give in my 2 weeks notice to this organization down in Florida called New Season, which helped pharmacists become collaborative in opioid use disorder. And I would travel to all of one of the 82 centers across the country and meet with pharmacists and meet with administrators and meet with politicians about the whole disease state. And it was a wonderful, fulfilling career, but it was keeping me from growing this publication. So I jumped off the cliff and
Awesome.
got beat up financially for the first 2 years. And it's doing much better now, but it's not for the faint of heart. It's not for people that aren't ready to get beat up for real.
No, I appreciate you sharing that. Yeah, and that was the point. I had that jump off point too, and I remember just being at home talking to my wife, and she knew, man. She knew how frustrated I was. She knew, like many of your listeners today, like I was tired of ideas being shelved. And like many of your listeners today, I wanted to move faster. I didn't want the red tape. And like many of the listeners today, I knew that there was something inside me that was calling out to do more. And so I made the call. They're amazing. Like, I want to give kudos to the Medtronic team. Just incredible people that just kind of said, "Hey, well, what if we do this?" And maybe we could give you, man, just incredible, right? Like, world-class organization. Grateful for the 8 years that I was there, but made this jump because here's what I saw, Todd. And you probably see this in pharmacy because the statistic is true for US businesses that that 50% of all businesses fail after 5 years, and 97% fail after 10. And when I was there, when I was working, you know, at the big companies, I was seeing these healthcare businesses that had incredible technology, awesome people with promise to our healthcare system and our health, and they were failing. And I said, "Damn, I can't believe that company failed. I can't believe that company failed." You've probably said that. I can't believe that company failed, right? And so I said, "There's more here," and so I jumped off. I went all in on Outcomes Rocket, and our mission today is we want to serve 5,000 health technology companies and helping them be successful and fulfilling their mission. And that's what we do today.
That's incredible. That's incredible. So when did you start seeing it really take off, and when you're pumping because it was Outcomes Rocket in play already, and you were doing two things? Because that's the way I had to grow PPN. I had to
Yes.
serve two masters. I had to serve my primary income and my role as director of strategy, and I had to grow this publication.
Dude, so literally, and by the way, like folks, I had a really great chat with Todd like before jumping on. And so yeah, we were chatting about podcasting, right? And the importance of kind of broadening that scope to serve more people.
Sure.
And so yes, while I was doing my career, I started the podcast. And that podcast evolved. Like we went all in. We were doing five episodes a week. And I'm a big fan of the 4 M's: model, mimic, master, and multiply.
Mm.
And anything that you do in life, think about the 4 M's and you will succeed. So I said to myself at the time when I decided to do the podcast, who's crushing it? So I found like a lot of different influencers, and I chose one. And I went to it. So I invested in a book that he had, and I flew to his house in Puerto Rico, and I stayed with him for 2 days, and I learned literally like his blueprint, and I got to work, and very quickly, dude, I grew Outcomes Rocket to now we're at 1,700 episodes, and we've built this massive network of amazing healthcare leaders. And it was that point where you do it a bunch, and then people started reaching out to us on, hey, how do we produce a podcast? So we started doing podcast production. But then what happens is this: you end up having all this content, and then what do you do with the content?
Yep.
So then we figured, oh wow, there's an opportunity for paid media. So you accelerate this content to get in front of your people, and this is we'll cover the three pillars of marketing. If anybody tells you it's more complicated than this, they're trying to sell you something.
Okay.
And it's basically owned media, paid media, and you ready for the last one?
I'm ready.
Earned. Okay. So owned, paid, earned. And by the way, folks, like what Todd and I do, like the podcast is part of your owned strategy. So everything that's owned is everything that is yours. Your podcast, if it's yours, you have your website, you have all of the SEO that you do, your social media content that you put out there, all that is owned content. The earned or the paid was the next thing, right? So you develop all this content, you could only reach so many people organically. It takes time, right? And you could build your organic, but if you want to accelerate, the next thing that comes in is paid. And so paid media is putting money behind your content, partnering with people through their distribution. Like if you want to get your message out on Pharmacy Podcast Network, boom, that's another way of paid, right? You pay to get access to the network. You have paid through the social media channels like LinkedIn, Twitter, TikTok, Meta. And then you have programmatic ads. It's all the paid stuff, right? That's how you accelerate a message. And then finally, there's earned. Earned is all about like developing trust through others. We call it OPS, other people's stages. And right now I have the privilege of being on Todd's stage, and I don't take that lightly. Anytime I'm on somebody's stage that they've spent blood, sweat, tears, money developing, like I take it very seriously. So my intention today is to add value, and what you walk away with today, you will be able to make at least another $100,000 within the next 6 months. I promise you. And so in each one of these pillars, we'll offer one tip that you'll be able to go take off with it. And if you do it right and you believe in yourself, you'll be able to do that.
That's awesome. That is so awesome. And the reason is because there are, as I said, there's about 305,000 active pharmacists in the United States, and there's a bucket anywhere from, again, I'm guessing 20 to 30% of them who are leaning towards the entrepreneurial track in a multitude of ways. One of the easiest ways is a pharmacist that has specific understanding of one sector of patient care. So pediatricians, right? Pediatricians need a pharmacist to be at their call in their mobile phone or on the floor of the hospital or in the community pharmacy or even the rare disease, where they can reach out to a pharmacist that digs super deep into the pharmacological and the medication absorption and titration and everything that comes with it, because the physician, aka the pediatrician in this example, doesn't have the time because of all the babies and children that they're taking care of to go deep into the medication management. So now they're reaching a pharmacist. So those pharmacists, and a shout out to Dr. Jenna Quinn, who took time to leave her comfort zone and develop a company called Perfecting Peds. And now they're one of our podcasters on our pediatric pharmacist review. And she, I'm going to send this podcast to her. But she's dialing into her specifics, and she needs everything to surround her to grow her business, as you and I have the specifics and the pillars that grow around our businesses. And so this podcast is important for a lot of those entrepreneurs out there that are listening in.
Yeah, I love that. A big part of sort of like the why, Todd, like beyond the mission that drives us to help healthcare leaders that are listening succeed, it's also to provide inspiration, that what you have inside of you, that feeling that I was talking to you, right? When I was in that moment with my wife, and she grabbed my hand and she's like, let's do this, babe. Like, let's do it together. And because it's hard when you make a decision like that. You've been there, right? And if you're listening to this, folks, you've been there. If you've made the jump, if you haven't, you're there right now. And the inspiration that we're trying to instill in you is make the jump, because we need it. We need more innovation, and we need to change the thinking. Like, what are we doing with PBMs?
Yeah.
Like we need to change the thinking completely if we're going to transform healthcare.
Absolutely. And that's so true. So take us into some of the definitions and giving away some of this amazing set information for these pillars, but give us some of the topics that people can think of and move forward on.
Yeah, listen, we're about to turn on the Todd Uri money machine here, right, guys? Get ready. You just like, do you want to fill a bucket with money or a barrel with money? So show up with whatever you want to show up here. One of the lowest hanging fruit in owned media that I find the biggest opportunity, it doesn't matter who I work with, who our team works with, is inside of your owned channel, you could be doing more with email. I know you're thinking email's dead and there's so much spam, but here's what I'm going to share with everyone. I'm going to share a mindset, an approach, and a very practical tip. The mindset is, it's dead if you think it's dead. It's actually not, because if you try anything in a single channel, it's dead. Like, you're not going to succeed. You got to think about it as a stool, either a three-legged stool or a table. You got to do everything in threes or fours, because it needs to feed off of each other. And if you're in pharmacy, you know omni-channel, right? At least you've heard the buzzword. That's basically a fancy way of saying all your stuff has to talk. So in email marketing, in order to be successful, you have to actually pair it with a podcast or social media or paid ads or a little bit of earned media. It's all got to tie together. And here's what you do. You might be saying, I don't have a list. Well, you actually do. If you're in business, you have a list. You have a list of customers. So for anybody that says they don't have a list, you do. You work with your customers, okay? And that's your first list. Now, maybe you have a bigger list. You're like, you know what? Yeah, I do have a list. Awesome. That's great. You're ahead of the game. So what you do now is you segment that list literally in two, maybe three. If you're a little more like ahead of the game here, maybe you segment into three. And what I like to do is the chronological segment. Like there's a lot of segmentation things you could do, but the basic one is like I've worked with this customer. Like I haven't worked with them 6 to 12 months from ago. Like they haven't worked with me in the last 12 months, call it. And this customer currently works with me. So it's two, right? The one thing is second money is always easier than first money. So if somebody has done business with you, it's going to be a lot easier for them to say, yeah, you know, I've done work with them. I'll do it again. So this list, you split it into two. You create a 3 to 4 part campaign for the ones that you haven't worked with in the last 12 months.
Mm-hmm.
There's so much that they don't know about you. You know, there's like so much that they don't know about you that you just, and you make sure that you approach them with the latest and greatest that you're working on. And you tee that up, you create 3 or 4 different emails. By the way, ChatGPT is fantastic to get started. So use AI as your friend and literally say, enter in ChatGPT, write 4 emails in a sequence to customers that I haven't worked with in 12 months in the pharmacy industry. And let them know that our latest updates could really help them. Insert pain points, right?
Yep.
You got to understand their pain points and you create your sequence. And then you do the same thing for your current customers and you create that sequence and then you put it out there. Now, here's the deal. If your list is smaller, I would encourage you to do things that don't scale and find out something unique about all of those people and say like, and here's what one of the things that we do that I'll share that works great. Go Google them if they're a business and then click on the news link.
Yep.
You know, the Google News. And then what is the latest?
Exactly.
Okay, cool. This is what we have found out. So then you do that with everybody and then you make it a field inside of your email list management tool. Hey, I noticed that the latest, and then insert the latest. Congratulations. Would love to connect with you. It's been a while. We have a lot of updates on our side too. All the best to you. Excited to connect. Here's my link. Like that's personal, you know? And so you run this and then you complement it with a social media liking and commenting strategy in addition to a phone call. That's it. Like those are the 3 things you're going to do. Let me tell you something. Most people are not going to do this. Like there's 2% of people that are listening to this right now that will. And guess what, guys? You're going to make that extra money. You're going to help those extra people because the other 98% are not. I mean, that's just sad. And if you think about it, it's kind of like the statistics, right? The 97% will fail. So what are you going to do? You have a plan right now. If you take advantage of this, your email campaign, you tie it to your social media strategy, and you make the phone calls. And you do that in 3 months, you will have at least 1 new deal.
That's awesome.
That's email. That's like right there, right?
I love it. Email's number 1. What's number 2?
All right. So that's under owned, and there's a lot we could cover. We're gonna go into paid now. Okay, the paid channel. And so under the paid channel, here's what I'll tell folks listening. If the one place you should start is owned, and then if you're not super tight on your messaging and your conversions on your site, don't do paid. But if you feel really good about when people go to your site, they convert. And what does convert mean on a site? It means they like something that you have on there, and then they go contact you for more information, right? A conversion on a website is you turn a visitor into a sales appointment or, you know, an inquiry call, you know, a discovery call. That's the conversion. If you're getting a decent conversion rate on your website, I'd say paid media. The tip is in healthcare, it is like LinkedIn is amazing to target people on. And so here's the tip. I'm going to save you guys a lot of money. Like basically you target people on LinkedIn at the cold layer. And everything, things change here and there, but right now what we're seeing is static images are outperforming video on the cold layer, because when you do ads, it's the cold layer. Then you get views, you get clicks, and then you go down to the warm layer, and then it's conversion. So for sales appointments. Now, when you're on that cold layer, you started on LinkedIn, but before you actually turn on that ad campaign, you actually, on your website where you're sending people to, you actually want to put both your LinkedIn Insights tag and the Meta pixel. And that's basically just, it's the code that you get through LinkedIn ads and the code that you get through Meta ads. Meta is Facebook and Instagram. That's the code that you get that you put on your site that just tracks the people that visit. You have no visibility to who they are, but that data is collected by the platform so that you could retarget. So here's the tip. You start that, you should not expect to get immediate returns until you hit like that 60 to 90 days. Like that's just the reality with paid. Sometimes you could get lucky and get some nice stuff coming in within those 30 days. But this is literally like at least a 90-day game. Like ideally, you're doing 120 days. So that's why I'm thinking like, probably if you're not seeing that conversion rates happening on your site, a lot of people don't know about this. It's called Hotjar. Do you know about it, Todd?
I don't. No.
Okay, cool. So there's actually a couple versions. I don't want to just say Hotjar. So Hotjar, Crazy Egg, Inspectlet. Those are 3 options. And what these platforms offer is, so Google Analytics gives you the numbers, the data, the quantity of people that have visited. These platforms give you the quality. So basically they record sessions on your site and you could see where people are clicking, if they're getting frustrated somewhere, if something's not working, if it's not converting. You're seeing session recordings. Wow. So you have validation that it's working or it's not. So like definitely get it. If you're still kind of figuring out your conversion rates, this thing's going to like, you're going to be like, whoa, I had no idea that was happening. And the heat maps and everything tell you where you need to be putting your relevant stuff at. And especially when you're running a campaign, you want to see when people are hitting your site, where they're going. Are they converting? Why didn't they? Is it working on mobile? What's going on? All these questions can be answered through the qualitative platform of either Inspectlet, Crazy Egg, or Hotjar. So check that out, folks. It's not very expensive, and like the ROI is there for those tools. You should have them in place. And then essentially, once you get people to your site, after 30 days, you actually start doing retargeting on Meta. And instead of paying $50 or $75 or $100, depending on who you're targeting per lead, you're going to pay $5 per lead through Meta. And it's phenomenal, man. Like you do the hard work, you pay the money. You still want to keep doing cold on LinkedIn, but the nice thing is after that 90-day period, you're going to be generating leads from Meta that are $5 a lead, $7 a lead instead of $50. Wow. So this is a hack, man. Like our clients love us for this, and I'm sharing it with you guys because you should be doing it. If you're not doing it, you're spending more money than you should on LinkedIn. I love LinkedIn. Like they're phenomenal because of that targeting capability. You target them, then you take them to your site, and then you retarget at a cheaper rate. So that's the paid tip. So take advantage of it. Do not do it if you're not happy with your conversion rate today. So that's the paid. Moving on to the earned. You good with that, Todd? Yeah.
Yeah, I finally understand earned media. It took me a while to understand how that expands a client's message, but I love it now. Like I'm pulling that lever a lot.
Are you? Smart. Smart. And you know, there's so many quotes I love around earned media and PR. The one that I love most is Bill Gates. He said, if I was down to my last dollar, I would spend it on PR. And PR is earned media. And you think about Microsoft and the impact that they've made It's not the best product, but damn, they've been successful. They're great at a lot of things. I'm not hating on you, Microsoft. I'm saying, like, I love you guys, by the way. You know, you guys have good stuff. I have a Surface. I love my Surface. I also love my Mac.
It's great.
Yeah, yeah. And so, why? You know, why is this? Here's why. People would rather see a review or hear about what you're good at and believe you more if it's coming from a third party than you.
Mhm.
And I always kid around, but this is very for real. Like, and it goes both ways for my wife and I. Like, she's like, babe, like, you know, these supplements are great. Like, and you got to take this probiotic. And I'm like, yeah, babe, I don't know. And then my trainer's like, dude, you got to take this probiotic. And then I go to her. She said, babe, I'm like, I'm taking this like, what? I've been telling you this for a year.
Yes.
Third party, right? Like, it happens at home, but it happens in business too. And so in business, if you're able to get the media to tell your story, if you're able to get an opportunity to tell your story with on somebody else's stage or on a media publication, you know, you're getting the credibility of that host of that outlet. And to Todd's point, it's actually not that hard to get it out there. And I'll give you the framework to get opportunities. It's very simple. And this is the framework is it's, you got to make it relevant. You got to make it unique. So like, and the unique thing, I learned this from actually an editor. She said to me, what is your argument? Cause I had sent her a pitch, right? Like, hey, we're doing things unique and this and that. And she kind of liked it, but we connected and she's like, what is your argument? What argument are you making? What is your point of view? That stuck with me, man, because I never really thought of, I'm reaching out to make an argument.
Yeah.
That's what they like, right? Like journalists, they really like an argument substantiated by data with a point of view, and the term is lived experience. So what about you as a person makes this story unique, right? Like, what is your lived experience, your point of view? If you add those elements into a pitch, and by the way, 500 words or less. Okay. So when you reach out to them, make sure that it's 500 words or less, and that the subject is not clever, it's clear. So what is it about? And then you reach out, and basically you say, hey, if you want to learn more, the piece is below. And this whole pitch is about like pitching a point of view, an article, right? Don't attach it. Put the article below your pitch and put it underneath your name. And when you put it out there, you do a follow-up if they don't reply. And then on your third follow-up, if they don't reply by then, you say, hey, I know you're busy. And here's how it works. Like everybody's on an editorial schedule. So like they got weekly timelines. So they respect that actually. So on your third follow-up, you don't want to go crazy. Like it's different than sales. Like with journalists, you want to just kind of 3-4 max and say, hey, look, here is just reaching out one last time. If you can't get back to me by Friday at 3 p.m., I'm going to go ahead and just, you know, approach a couple other outlets with this story. No problem. And maybe in the future, you know, we could work together on a piece. Thank you so much. I can't tell you how many times I've done that and I've gotten a response, either yes, or, hey, not at this time. This is the angle we're looking for. But we've gotten a lot of really cool opportunities out of that for ourselves, for our clients. And this sort of approach, just document it, hit rewind, and just kind of write it down, because it will work for you. And then you host it on your site. What does it do for you? Once you have it there, if a tree falls in the forest, do you hear it? No, right? Unless you're really close. Yeah. So it's your job. Okay, the tree fell down. Now you got to put a megaphone on it, omni-channel. So you know that email list we were talking about? Tell them about it. Hey, we just got featured on this news media. And then, you know, that paid we were talking about as part of your creatives that you put out there, you know, we just got featured and these are the 3 tips that you could benefit from. And hey, talk about it on your podcast. And then, put it out there, tell other media agencies about it, because press begets press. And what all of this does is, and by the way, put it at the bottom of your signature, and put it on your sales quotes, because there's nothing better than customer testimonials and third party stories about you to really help people get confidence about what you do. So essentially, you do these things, it shortens the sales cycle. It could take somebody that's considering you and doing research, and then they see all this stuff and they choose you because you have data that's not just you saying it, and they decide to call you and go with you because of it. It really does help shorten the sales cycle. It really does lower the cost of acquisition if you make meaningful progress in this. So that's the third tip around that, and really, take advantage of these tips and do something with them, because I promise you all, if you do, you will get results.
So there are there's a bunch of different listeners, but I divide them into two categories. Our entrepreneurial pharmacists, they're out there building businesses, like I mentioned, Jenna, and then organizations who are established, who have pharmacists and business people involved in there. And though I serve both of those kinds of clients, I serve the individual that's building their business, and I serve the corporation or the company that's building their business and doing other things. So in the entrepreneurial side of things for earned media, is it the individual that's reaching out to the press people because they don't have the financial resources to hire an outcomes rocket to do it for them, or a
Yep.
fin partners, for goodness sakes, or someone that's in PR? So talk to us about the one man band, or the two person band that's out there.
Yeah, for sure. I mean, that's exactly it. Like, write a piece that's interesting and put it out there. Like, literally, the structure that I gave you is what you should be putting out there. And just know that it's going to take time. And you can just reach out one journalist at a time, or two at a time. I find that if you're selective about where you want it, I mean, obviously you got to be realistic. Like, you're not gonna go to the New York Times, and get published on the New York Times. Like, it just, you got to be selective of kind of what's a good spot for you. We talked about omni-channel, so I'm telling you to email the journalist, but I'm also telling you to reach out to them on social media, to connect with them wherever they are. If you find out that they like going to a certain event, then if you're going to the event, find them, network with them, and shake their hand. Get to know them, get to know what they like, because at the end of the day, it's a relationship game, and you'll be thankful you did. It could be done by an individual. There's an organization that actually does provide a lot of resources for the individual looking to do pitches like this. Um, I'm gonna give you the link. I'm not thinking of their name, Todd, but in the show notes, maybe you could reference it.
Sure.
Because I'm not thinking about their name right now, but you'll see that in the show notes.
Excellent. Excellent. So people are listening, they're interested, they understand what their challenges are. Sometimes it's layering. Sometimes it's getting their first 10 customers and then going to the next level, going to the next level. But I like the fact that you are putting people in a cycle and repeating that cycle and making changes to one of those 3 points or one of those 3 parts to adjust and make each part stronger. And then of course they all complement each other. So that cycle is excellent. I love that.
Thank you. Yeah, and it works, man. Like, and if you're consistent with it, it works really well.
Where do you see Outcomes Rocket helping in the realm of reform in what is the bane of healthcare, both pharmacy and just general healthcare, which is the insurance industry that kind of sucks the joy out of healthcare of many physicians, many pharmacists and nurses. But what are you doing in the advocacy sector? Or do you have any clients that are in the advocacy or reform or anything like that? Because that's one of our hottest topics right now is PBM reform.
Yeah, look, a lot of the businesses that I was chatting with you about, many of them are focused on taking cost out of the system, of being more transparent about pricing, about providing, coupon programs through electronic medical records, like making these types of drugs that everybody needs more accessible. And so we work with clients that have technologies, that have products, that have consulting services that are aimed at taking cost out. So a lot of the work that we do, we talked about, we don't want to see them fail, because these customers and the people that we have on our podcast are thinking about ways to take cost out. And the opportunity is there to be able to support each other. And that's what we're focused on.
Awesome. It's terrific. Marketers, assisting marketers in strategy. I love talking about it. We have a group of people in pharmacy. Nicole McClure, GRX Marketing, is just amazing. And she thinks outside the box. And Bruce Nealon, I just got off the phone with him. And I'm going to bring this up. I'm going to share this with my marketing friends to be able to
Nice.
powwow and grow. Saul Marquez, Outcomes Rocket, this has been a pleasure. And we very much appreciate you being on This Week in Pharmacy.
Thanks. It's been a pleasure.